Hello, welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer DeSablo, your host for today's show. Through this monthly show, Franklin County Home Health Agency brings you information about the agency's programs and services, as well as helpful tips to help you and your loved ones stay safe and healthy at home. On today's program, I have two guests with me who have been on the show before, and I welcome you back. Mary Harwood is our Community Relations Coordinator, and Amanda Wilson, a Medical Social Worker at Franklin County Home Health. So thank you both for being here.
You're welcome. Hi, Jen.
Hi. And today we're just going to be having a conversation about advanced directives, end-of-life planning, and we'll be talking about a program called Start the Conversation. So let's talk about this, and the reason it's called Start the Conversation is because this can be so hard to start sometimes. When we're talking about end-of-life, folks don't know where to begin, and so we want to kind of model that for you today and talk about having that conversation with loved ones. So thank you for doing this for us. As a social worker, this is something that you do at Franklin County Home Health Agency. Can you just, before we start, give us a little bit of information about your role at the agency?
Sure. As medical social worker with home care referrals specific to this work, we're often getting referrals to work with people in their home and talk to them about long-term planning, end-of-life planning, and completing advanced directive documents. So the Start the Conversation tool is really great to open that up, have a cup of tea, make it a conversation, sitting down with family. And what I often do is make it a more normal process by having multiple family members complete advanced directives at the same time. So I'm not just saying have an ailment, we need to do this. It's everybody should be doing this. Mm-hmm. Everyone should be having these conversations and completing these documents.
Absolutely. So no matter your age or your well-being at any given time, that this
Sure.
is an opportunity.
Yeah.
So as we get into this, after we introduce it a little bit, we'll kind of almost model that. So Mary could be like a patient or anybody, mm-hmm. And then I could be like an agent, mm-hmm. as you said. So can we talk about those roles, agents, and as they relate to advanced directives?
Yep. So identifying an agent, a healthcare agent, is kind of the first step. Your healthcare agent is going to be the person who you identify as trusting to help act on your behalf. So it acts like a power of attorney, but it doesn't take the power away from the individual. It doesn't say this person is going to make decisions for me. It's this person is going to make decisions on my behalf when I can't. And the role of the agent is really to put the hat on of the person that they're working with and think, what would they want? Not what do I want for them, but what did they want? So identifying that person that knows you best and you trust the most is really the first step.
Okay, so just to clarify, I like how you put it. There's a power of attorney who's sometimes identified in cases to make decisions for somebody, mm-hmm. but the agent is different in that when you cannot make those decisions, they make them for you.
Yep, and the healthcare agent acts as a power of attorney, so they carry kind of the same weight, but the idea of a healthcare agent, similar with power of attorney, the idea is you're making decisions as if you were this person. Okay. So knowing them well is really important.
Okay.
Well, that was one of the questions I had. I mean, I could have my husband be my healthcare agent, but what if I didn't feel comfortable putting him in that position or mm-hmm. having my kids put in that position? Are there other ideas of people I might consider for an agent?
Yeah, that's a common kind of dilemma. People think that the responsibility automatically defaults to the spouse, which isn't the case in Vermont. It defaults to the person who knows you best. That could be a neighbor, it could be a child, it could be anyone. Spouses sometimes want to keep their loved one mm-hmm. alive as long as possible, and that might not be what the person wants. So when you're choosing an agent, again, you want to choose the person who's comfortable with the responsibility of acting on your behalf. So it might be a neighbor. It might be somebody that you've known for a really long time. It might be a friend. It might be a cousin. It could be any person who's willing to take that responsibility for you.
I could even say, ask one of my sisters.
Absolutely. Yep. And that's quite often what happens is it's a relationship in that way because they're attached, but they also have a different level of love and relationship and protection. It's pretty interesting.
And is there an age limit on the agent?
Excuse
Is there
me?
an age limit on the agent? Can you have a teenage child? Or
I think that you need to be 18 or older to be an agent.
Sure.
Yeah, and you can also have an alternative agent. You can have co-agents, which we don't typically recommend because they have to be on the same page. You can have an alternative. So if your agent is unable or unwilling, there's an alternative that you can go to.
Okay, very good question, Mary, about who to be your agent. And of course, you'd have those conversations with them. And how, talking to somebody about being that agent, how do you start that? So we have these booklets that we've all shared called Start the Conversation, a conversation guide. So that's going to help you, tell me about that. What's that going to help you do?
So the Start the Conversation Guide it was a project that was launched a couple years ago by a group of home health agencies. And what it does is it outlines how to have the conversation. It acknowledges that having these conversations about end-of-life care or treatments is difficult. It's a hard conversation to have. So it has some little tips and tools, and it walks you through it. And it has great tools in here to help you ease into those conversations. So it's not just right away filling out an advance directive and it's set in stone. It lets you have some conversations about your values and your beliefs and your goals.
Mm-hmm. I notice it starts out with options. So what are the kind of options that you could consider?
Yeah, we were chatting a little bit earlier today about having an advance directive, and everyone should have one. We all do, actually. By not having an advance directive, we have an advance directive, which is full treatment. So that's your first option, is to decide you want full life-sustaining measures to keep you alive as long as possible. That's what doctors and hospitals, their default care is. So as you move towards your life with your changes in health or age or circumstance or values, you may decide at some point that you don't want everything done. There's a type of service called palliative care. Palliative care, you can still be engaging in curative measures for a disease such as cancer or something else, but your focus is more on function, keeping the highest level of function that you can in your day-to-day life. But you also get some benefits of that, some additional services and supports. And then kind of along a continuum as you move through your life or your circumstance, there's also hospice care, which is an end-of-life option. Hospice care is for folks who have a terminal diagnosis with a prognosis of less than 6 months. The focus with hospice care is strictly on comfort, dignity, and quality of life. So the person at that time has decided to forego any life-sustaining treatments. They still have pain management. They still have therapies to keep them comfortable and moving the best that they can. But every decision is made based on comfort and quality of life.
I think it's important to note that all of these services are offered through Franklin County Home Health, be it on any part of the spectrum. You're getting curative types of care. We're supporting that at home if you're at home, and palliative, as well as hospice. So.
Yeah, and what's great about our agency is all of our nurses, social work staff, and therapists provide care at each of those stages. So you can have relationships with your clients and your patients, and they can have relationships with you through their lifespan, which is, I think, really great.
Yeah, for the patient and the family.
Yeah.
That is great. On the hospice thing in particular, I've had experience fairly recently with hospice, but not in Vermont. And in both cases, it was my mom and my mother-in-law, different diagnoses. My mom had kind of been losing it, and she had a lot of memory issues, and she was just failure to thrive, and they wanted to put a feeding tube in. And we just went, no, you can't do that. And that's when it was interesting. The assisted living where she was said, why not hospice? And it never occurred to me that you could have hospice for somebody with dementia. And it really was, I think it made her last 6 months so much more comfortable. She would not have liked the feeding tube at all. She loved her chocolates. I don't think you can put a chocolate in a feeding tube. And kind of the same with my mother-in-law. She had this like blood pressure thing, so just as she got frailer and frailer. So how often is it really common that people have hospice in someplace other than home?
It can be. Hospice services. Hospice is a benefit, and the services under hospice can be provided in a person's home, in a family member's home, assisted living, skilled nursing facilities. You can have the hospice team coming in and supplementing the care, which I think is a really great collaboration. And then there's the Vermont Respite House in Williston. So you can get hospice services and care in a variety of settings. What's unfortunate is that not everybody knows about hospice, that it is a benefit, that it's a support service that can be provided long before someone is truly at their very end of life.
That's another great place where this showing you some of those options gets you talking and asking questions about hospice, like you said, before it's 6 months or even less. A lot of times, sometimes people come on even less, and the family and the patient still benefit, but you often hear, we wish we had known about this sooner, or somebody had known about it. So this is a great place to start early on, before you're, like you said before you're even sick.
Yeah.
Would that be an option that I'm interested in? And to share that is so important. And because hospice, we should also talk a little bit about how they support the family during the process, and then long after for grief bereavement support.
Yeah, hospice services are it's a pretty wide array of services, and it's very individualized for whoever needs it. Hospice provides skilled nursing services for medication, pain management, any skin needs that they have, social work services for the patient and the family. The hospice philosophy is really providing for the entire family system, not just the patient. There's therapies that are needed for quality of life, physical therapy, occupational therapy, speech therapy. We have volunteers just to have someone there. We have homemaker services, so if you need some help, cleaning and doing some of those things, we have that support. There's also hospice chaplain, so spiritual services. If you don't have a particular church connection, we offer that as well. The LNAs, the licensed nurses' aides, for bathing and helping people get ready in the day. So it's a really great support. And again, those services can transcend into a facility like assisted living or a nursing home. So they're getting what they get there, plus the additional hospice support. One of the great things, my favorite things that I do with my job is bereavement support, and only under hospice care do you get up to 13 months of bereavement support for family members who have lost a loved one. And
that's wonderful, because as we all know, grief doesn't end right off. It can linger, and that helps people.
Yeah. And another point is grief doesn't start right when they lose somebody either. So the importance of having hospice services or hospice-like services, whether it's palliative care or hospice, as early as possible when there's a terminal or chronic disease, so that social work staff and others can help people in that grieving process that starts pretty immediately after a diagnosis.
Yeah, I noticed that with, that was in particular with my mother-in-law, is that once they put her on hospice, they were asking her questions, and she was very with it, but so she was directing exactly what she wanted. She told everybody what she wanted for her funeral, where she wanted to be buried, where she wanted her services. It took all that decision making away too.
Yeah.
So it was great. It was really a wonderful thing for her to be able to tell us.
When we ask the questions, folks will typically tell us what they want.
When you ask, as you said, sometimes you just don't think to have that. It reminds me of the hospice trainings we've done at the agency, where community members are invited to those trainings, sometimes to then become a volunteer, or other times just to understand all of these things that happen at the end of life. So when I went through the training, that was the very thing, like, oh, all these options about funerals and all these things you wouldn't necessarily consider if you didn't start talking about this uncomfortable stuff that we all want to avoid. But when you talk about them, you take a lot of burden off of people and yourself, and you know that you're getting the care and even aftercare that you would have preferred. So,
and the decisions will have to be made at some point for everyone. So talking about it early on, before we're in crisis and emotions are high, it tends to go a lot better than trying to deal with all those things in the moment.
Exactly. So is that having, saying you would like to have the option of hospice, is that something you would put in an advance directive?
The most frequently used Vermont Advanced Directive, it's a short form, doesn't ask that specifically, but when I go out and I complete Advanced Directives, I do ask people, and there's a box for other when it's talking about where you want to be at your end of life, and I will check off and indicate if they want hospice. Sometimes if someone is in a setting like a hospital or a nursing home or assisted living, if the folks caring for them don't know that they wanted hospice, then they wouldn't know to offer it or start that conversation.
So usually we think of doctors and care providers being the ones who sort of direct care and plan of care, and they might say, oh, this is the time for you to be on hospice. But that's not necessarily always the case. Or can you talk about the doctor's role and the patient's role?
Yeah, the medical model of care that's like the common discourse is to treat and to cure. Hospice hasn't taken off. Talking about end of life and paying attention to it in an open way without a stigma associated to it isn't the norm yet. So doctors are trained to keep people alive as long as possible, to extend life. That's the whole kind of philosophy behind their training. There is some new education opportunities out there for doctors, nurses, all of us to learn better how to have these conversations. You know, you can undergo this treatment, or you can choose this. I think giving options is really important. Another framework of thinking is that it's not just the doctor's responsibility to give options, but it is truly their responsibility to, in their professional expertise, suggest which way to go. And it's not always the treatment that may extend the life by a couple months, but what's the quality of life going to look like?
Yeah, that's a really important point. Yeah, so,
And
wow.
hospice is, as a model, has been around for about how long?
I think the 70s, really.
It takes time.
It does take time. That's not really that long
Yeah.
for something with such a negative connotation like death to take off in such a positive way. As part of the hospice team, it's my favorite thing that I do with the agency, because I get to walk through that process with people, support them, and I've been part of some really beautiful end-of-life experiences for patients and families. And I think that's a gift.
Absolutely.
Yeah, that really would be. Wow. This is all great background for starting our conversation today. But one more thing I wanted to ask. I had some surgery 15 or 20 years ago, and I filled something out. I think it was called a living will. Is that still valid, even if I don't even know where it is? I assume it's at the hospital. I don't know. But
So later, Mary, we're going to update that, because we need to find that. It is still valid. If you have a living will or an old form that's on file somewhere, it is valid. It remains valid. Though any advanced directive or indication of your treatment wishes should be updated at least every, 5 to 10 years, but especially depending on changes in your health or in your value or belief system as you move through your life. My advanced directive in my 30s will likely be very different from when I'm 60s, 70s, 80s, 90s.
Yeah.
So it's important that it change as we change through our lives.
So can we talk about, Mary said, I don't even know where it is. So first step is finding a form to fill out. Where do we get these? And then what do we do with them? Where do we save them when we have done one?
Yep. There's a couple of options for filling out an advanced directive. We have the documents in our office. So if you're connected with home health, or if you want to just call home health, we can help someone get access to that. They can be downloaded from starttheconversationvt.org. And then the Vermont Ethics Committee, their website has this great little booklet. It's called Taking Steps, Planning for Critical Healthcare Decisions. And this has inside of it, it walks you through, why to make some of these decisions and what they mean, which I think a lot of people need some of that nursing education about what that means. And it has a copy of the form in here. So you just peel it right out, and there's a copy of the short form, which is the most frequently used form right now. It was updated not so long ago. So you can get them there. There's also a registry form in here, and when you complete your advanced directive, you want to have it sent to the Vermont Advanced Directive Registry. They upload it into a computer system and make it accessible all over the country, really, with whomever's participating in that system. So let's say you fill it out here in St. Albans and you end up at Dartmouth and you don't have a copy of it. Dartmouth can go online and bring up a copy of that document for you.
That's great.
Yeah. One other thing to note, when you have completed it, it's really important to make sure that you disseminate to all the right people. So you want your agent to have a copy, an alternate agent. Any doctors that you're connected with, you want to send a copy to them. Again, the registry, if you're involved in a home health agency or visiting nurses, you want to make sure that they have a copy as well.
Sure.
Oh, that's really helpful.
Especially disseminating it to your agent, just top of mind, keeps them aware of your needs if they've changed, or understanding if you've done a new one, they get a new copy. So
Yeah.
wonderful.
And then if you want to find it later, you know that
Yeah,
everybody has a copy.
Online.
Yeah.
Wonderful.
But also I know on the conversation guide too, I just wanted to add, I know we have these available in our office, and they're available to anyone. You just call our office and we can provide the conversation guide for someone. You know, because we see this as one of our community services.
Yeah, I've literally used them sitting at tables with people. They're really great.
But the other thing I wanted to say is, like, I was going through this, and Jen, you were too. There's some questions in here that are kind of tough.
Yeah.
Okay. Talk to me more about that.
You know, like, you had some good comments.
Some comments that I had were, just like you just said, in my 30s and 40s, I'm going to feel a little differently. So there's a nice tool in here, about 5 pages in, that has a little questionnaire, and it asks you to rate on a scale of 1 to 5. I'd really want treatments to keep me alive, or no, I can do without those treatments that keep me alive. I want comfort care. So, and it brings you through, 15 or so things, such as, I can no longer walk, but I can get around in a wheelchair. I scored 1. I really want to keep going. And then they get a little deeper, and it's, I'm on a feeding tube to keep me alive. I'm on a breathing machine to keep me alive. I can no longer think or talk clearly. But today, as I'm filling it out, I have more hope. I shouldn't say hopeful. I just have a different idea about what that care would look like for me and what I want to do and how my life's going to continue. Whereas if I'm 89 and I feel like my quality of life would be different, I'll be on a different side of the scale. So like you said, it's okay, because you'll do this again and again if you start young enough to change your mind if you need to, or to at least have that conversation with your agent saying, check in with me, how am I feeling about these decisions that I thought I made. Second idea I had as I was going through it was, when you're doing the questionnaires, this is not the advanced directive. This is just helping you sort out the conversation. As I'm writing this here, I'm not setting in stone that I don't want a feeding tube. I'm just saying, oh, that's how I feel today. And it's helping me get to the next step, which is then you do have to fill out some directive. But first, take the time to just explore this, I guess.
Yeah, I'm glad you brought that up. The advanced directive does have 4 very clear, do I want CPR, would I want a feeding tube, would I want a breathing machine, and would I want antibiotics at my end of life. And those are very black and white. It allows you to say for a short time to meet in the middle, but they are very black and white. So this is a really great tool for the person completing it and their agent, because it's not always so black and white. So when you have these conversations and you talk about what you're looking for in your quality of life, that's what helps guide your agent to make some of those not so clear decisions, putting your hat on, not their own.
Right. And then, like you said, it does continue to ask spiritual questions and other things that you can have that conversation with your agent.
Yeah.
So we have about 5 minutes left, and I just want to be sure we'd share with folks about Start the Conversation. Mary, you had some news about trainings, or?
Oh yeah, there's going to be a training that we're holding training for presenters and facilitators around the state, and they're going to be people that'll be trained to come into your community, come to a group that you might have, to make presentations on Start the Conversation. And so what we're also looking for are people that have that idea. So we'd love it if people could call us and say, gee, we'd love it if you could come up to Richford and give a presentation at our library, or I'm in Swanton and our church group would like you to come. Can you send someone? So we're hoping to develop a group of people that will be able to do that in the community. So it's not just our staff, because we're only so many people, and it's great to have the whole village, so to speak.
What a great forum to get
Yeah.
these incredible guides out. And like Amanda said, you can call our office and request one. You can see it at a forum, have a great place to ask questions. We have links on our website to the Advanced Directives sites, the Vermont Ethics. Is that correct, Mary? They can find all of that online or linked.
Right. Yeah.
And we encourage people to start thinking about this at any time and to talk with their loved ones. So thank you both for sharing this topic with me today. Is there anything else you'd like to add, Amanda, before we close?
I just wanted to mention that April 16th is National Healthcare Decision Making Day. So if anyone, especially on that day, wants to talk about or complete an advanced directive, reach out to Home Health, reach out to your local area on aging to get some support, call your doctor's office, ask them to sit down with you and go over that form. It's really important that everybody gets one of these completed so we can honor people's true wishes.
Great, what a great day to have that happen, April 16th. Thank you.
You're welcome.
And
That's good.
thank you both for being here. Again, thank you for watching. If you have any questions about our topic today, you can call Franklin County Home Health Agency at 527-7531, and you can visit us online at www.fchha.org. We offer home care, hospice, and palliative care services, and we welcome the questions you may have about planning for end-of-life care. We also help people recover from illness or injury in their home and stay safe and independent at home. So please check us out online or call our agency and learn more, and connect with us on Facebook. We'd love to engage with you there. Thank you for watching. Be well.